Ke MLA jong ke East Shillong constituency ke Kong Amprin Lingdo mendak sngi. Kala thiar tinge ke Sorkar Jylla ha ke baidi bagajing kun ke kram COVID-19 po ke Jylla. Ha bai krem gelap thai Khubor mendak sngi ke Kong Amprin kala itu bawala ke don kano ke Jingsha ke dokti na ke benta kino ki kam ke baidi ber ki khau ki bahab apa ke GOI scheme ke social welfare scheme na ke benta ke jingrap se ki khulung khna ke Sorkar kam ka wan pau ha kamat gelap thai Khubor. Berkelai itu wamla membatai syaki pajba babaro kilong babiang renti lun. Kini kejinglong jingman kibayaja hakini kesingi. Dawa na Sorkar bahkan batai syai halor kini kekenom kenam pajba kintip ya kejing shisha. Berkala benrap lu rega boong babaro kidan kejing syania hak Sorkar. Wat ngimla bansut rais new yaki lada Sorkar ke Jingpynshai menta lani hak session ke bansawan. Habai depa bagajing syak penduk tulop jangki accredited social health activist ke MLA jong ke Shillong gelong bakalong ke jing songsi ke bakrau ban ui ya kino ya kun ha kini ke jing kun persya ya ke klam bakim yo ya kano ke jing arab nak Sorkar barkalong bakinong tri asya barbor kisha thombor perkumta na galyang ke assembly committee for the empowerment of women kalashimti ya bontli jing toket ha bai de jing sha thombor jing ki asya ha ke bai de jing kren jong menteri ke tanat ke koi ke kya bakiladon hadu san hajar ngot ki khna ki bala syakta ha kunyang jingpang COVID-19 ha ke Jylla ke Kong Amprin Lingdo kalabu ya ke jengkli balai ke Sorkar kamsim kya ya kini wala kelas dang mun penkre na ke benta ke third wave barkalong balada ki khna ke don kam ya ke jing smar ke bapaka hatu ki yo ya kini ke jing smar ke biang lut na rong sawdong ha ki hospital jong ki khna rit barkala kerpar ke Sorkar bagade ban Jingpynshai se ki pajba barka deiru ban pan jingmut na ki bei pat kinang ilam sain perthei.
See, when there is an allegation of diversion of food grain, especially under Government of India schemes like the social welfare scheme for the supplementary diets of children. Government does not on its own, in the face of the CM or the Deputy CM or anyone, try to clarify verbally on a press conference. It is very important that necessary steps are taken. And it is also very vital that an inquiry has to be constituted. This inquiry will be able to give the public correct access to information as to why the government of Assam actually confiscated 12 to 15 trucks of about 150 plus bags of rice allocated from the FCI for the important Government of India scheme for supplementary diets for adolescents and children. Now you cannot categorically just state on a press conference that everything is fine and everything is under control. If the government of Assam had confiscated these numbers of rice bags, and if the government of Assam has registered a case on the border of Assam and Meghalaya, somewhere near Dutnoi, public demands that there should be clarity. What is the inquiry committee that was constituted? What are the details of the finding of this committee? Public will not rest till these clarifications are made public. Well and good that the Honorable Chief Minister of the state of Meghalaya has already stated that there is nothing amiss, but provide the details of the report. Who is going to chair this committee? What is this committee going to be called? And give us answers to the many questions that are being asked. What kind of food supplementary are you going to make from 150 gunnies of rice? Gunny bag of rice? Why do you have to again send this rice to another food supply system and then say that this is meant for that and therefore this rice was taken there? This is an important lapse, and government cannot wash away the details that are now being sought by the public. It is the right of the public to ask, and we would like to see this happening. Very good that the Honorable Chief Minister has given the necessary clearance, assuring the public that nothing is amiss. But where is the committee? What are its findings? We will get our space to ask these questions, but we don't want to wait till the next session. So tell us now, because covering tracks from now to the next session can be something which can be easily done. So these are the demands that are very pertinent, and we are demanding for an inquiry. We will not be suspicious of our own government. We have faith in our government. Whether the government gives us these inquiry reports now or wait till the next session, time will tell. But we will ask, we will demand. Because you cannot just, brush aside another state arresting and confiscating so many bags of rice that was meant for the people of the state of Meghalaya. Clarity is sought. You have to give it to us. I feel that it is very disappointing to see an important segment of a workforce that is the only link between the government and the people on the ground. An ASHA worker, by all rights, needs to be given the justified remuneration for the work that they are doing. Already we are aware that a pandemic has now been declared a national disaster, which means that funding for the protection of the welfare of ASHA workers is already in the pipeline. The government has to step up and has to take necessary measures and decisions to ensure that ASHA workers do not find ground to protest during such a crisis in the state of Meghalaya. I feel that ASHA workers need to be paid regularly like other health department service providers. ASHA workers have been from time to time victimized, and this is not fair. From the committee for the Assembly Committee for the Empowerment of Women, we have taken up several cases of injustices done against ASHA workers. This is a period of pandemic. It is a national and state disaster. There should be no question that government should not draw out necessary policies for the welfare of this segment of workers who are now, by and large, available in every village, in every block, in every CHC, PHC in the entire state. I send my feelings of concern, and I support all demands being made by ASHA workers. We will be taking this up as well from the Assembly Committee for the Empowerment of Women, because we know that ASHAs are predominantly women. And I feel that it is very disappointing that this government should be so insensitive and should turn a deaf ear to the demands made by this group of individuals who are at this moment risking their lives in their attempt to contain COVID-19. I demand that immediate action should be taken, and I demand that any action taken for the improvement of welfare measures for the ASHAs should be made public. Government should draw a policy immediately, and all ASHA workers should be under coverage of various insurance schemes. They should also not be coming out into the streets in demand for payment of their salary. Question does not arise. Government should take note of this, and we would like to see that the ASHAs are back on their jobs, because the pandemic is not over. It is not over yet, and believe me when I tell you that on the ground we are aware that several individuals in various localities across the state are still testing positive, even if the government is reducing its testing facilities like RT-PCR and other facilities, which are very important for us to understand how the pandemic is actually shaping up in the state of Meghalaya, and how the pandemic is actually now to be evaluated immediately in mind of the third wave that might hit our state in the days to come.
One more important thing is that
the entire approach towards the calling of a lockdown by the government of Meghalaya seems to be going very wrong. I'll tell you why I make this statement. When a lockdown is called and declared by any DC of any district, it is actually a period where all government machineries should be stepped up to face the onslaught of the pandemic in those districts. The million-dollar question that we need to ask the government of Meghalaya: you have put the state on partial or complete lockdown from 26th of April till today. Why are we hearing a health minister of the state government saying that there is a shortage of manpower? I cannot digest this irresponsible, callous declaration by a government that we don't have the manpower. What were you doing all this while? Lockdown is now affecting every household in the state of Meghalaya, let alone the situations in red zone areas, where we are actually burying people by the dozen every week. You cannot say that you don't have the manpower, and you are bounded by duty to make sure that during this lockdown period, all of your facilities in all health centers should actually be responding to the pandemic. You cannot have a lockdown and then again extend a lockdown and say that, well, we are now making do with whatever we have. It is wrong. Government of Meghalaya has access to funding from all agencies across the board. Why is the government of Meghalaya not interfacing with the government of India firstly, with other agencies like the United Nations? We have to reach out. You cannot keep quiet about the necessary interventions that are required to be put in place. That is why the public today is restless. We are restless because we do not know which direction we're going in. There seems to be no pre-planning. This government is only reacting to situations. You cannot have a government that is reactive. You have to have a government that's in charge of things. As we read the media and other social mediums of information sourcing, we are getting more and more disappointed. Scams are arising. Hijacking of important food grain is what is in the minds of the people. Illegal mining is again a question that comes up again and again. We cannot afford to be progressing in the midst of this war against the pandemic with this kind of an approach. We cannot see laxness of government in any sphere. I understand that the government is working hard to ensure that oxygen supply in the state is being put in place. Where will this oxygen go if you don't even have ventilators? What are you going to do with that oxygen? You had announced 2 months ago that you were going to come up with a prefab COVID institution, state-of-the-art institution. You said it would be done in 2 months. And today you're telling us that it's going to complete in September? What kind of a government is this? How can the people have confidence? Right now, every citizen in the state is afraid of COVID. What are you doing to put our fears at rest? Are you putting any efforts? We cannot accept this. We expect the government to rise and respond in the correct manner. Because the people of the state now are actually deprived of any livelihood. They are deprived of food supply. Look at the way the government is handling the immediate sanctioning of ration cards for non-ration card holders who are permanent citizens in the state. Government has announced an ex gratia payment for COVID deaths. Where is this website? Where should the people send their documents? Do we need to tell them what to do? Today I had residents who came to my door saying that we need to Xerox certain documents because we have to submit for claim under COVID death of our family member. Where will they go for the Xeroxing? This is the age of technology. Why cannot the government, under the ambit of the DC, start a website where a resident sitting from the house can just take a photograph of the death certificate of someone they have lost, and why can't they send just that to the DC? Why? Why is this harassment going on? Many people have lost their loved ones not even 1 month ago, not even 1 week ago. You're making them run pillar to post for a Xeroxing machine? Why should they submit this to a third party or a fourth party, be what it is, whether it is an MLA, whether it is somebody from the Darbar? Why cannot people access a direct medium with the DC? See, these are lapses which are very unnecessary. My doors are open. People can come for Xeroxing. I have no problems. Why are you exposing me or them to the spread of COVID? So you practice what you preach. If you say that this is a lockdown, have facilities available for individuals. People have just lost a husband. People have lost a son. People have lost a daughter. You expect them to run pillar to post? What is the way of rolling out this ex gratia scheme that the government has announced? We need to know, and we need to have systems in place that will ease out the pain, the suffering, the hardships of the people. What is this government going to do about wages for workers who have not been able to go to work? What are you going to do? What is the instructions given? Where do people go? I just found out this morning from one individual who is holding an account and is a member of the Building and Other Construction Workers scheme. Have you forgotten about these building and construction workers? There is enough money in the account in the Labour Department. Why are they not activating? Why is the Labour Department not coming out with a forum or a medium where all who are account holders of the building and other construction workers actually can access? Who's going to pay the house rent when there is no livelihood? House rent is very much under the ambit of the scheme for building and other construction workers. So these are very, very important agendas that people feel. I am not speaking just as an opposition MLA. I'm speaking as one who is part of the system. I know the ground realities. People come to me with their problems. I urge the Honorable Deputy Chief Minister of the State of Meghalaya to once again open out schemes for building and other construction workers. Very important. There is money in that account. They should open it and operationalize it again. Last year, they had promised to send some amounts of money to people who are registered under the board. Many of those did not get even. We need to know, why is the government waiting for somebody to prompt them? On their own, they should be acting. You have called for this lockdown because you need now to get your officers on one bench and you need to start thinking of the things you got to do. If an MLA can do it, if I can start a wage loss financial assistance scheme, why cannot the government do it? Why cannot the government do it? Why are there no designated funds? So these are some of the very important things that are happening around us, and if somebody doesn't act, there's going to be desperation, there's going to be anger, there's going to be disgust, and things are not good. So we should stop painting a rosy picture. The ground reality is something else, and government needs to act. I cannot imagine that the Health Minister of the Government of Meghalaya happily announces that over 5,000 children have been affected currently in the last 1 year due to COVID. And I cannot imagine that in the state of Meghalaya, with the exception of a few available pediatric ventilated beds in Negrams, there is absolutely no ICU. They call it PECU, pediatric ICUs. Now you are telling me that all these years, no Department of Health ever alerted any government that this was the scenario in the state of Meghalaya? Why weren't we alerted? We have also been in government, I agree. But why has this indication not been given to the government to take necessary action? Which hospital in the state of Meghalaya has a PECU? What are you going to do about it? There are about 7 to 9 PECUs available at Negrams. I am informed. I may be wrong, I may be right. Why? After 50 years are we facing this? Is it because children have no voice? Is it because children cannot scream and protest on the road? I was appalled to get this information. In fact, we just had a Zoom meeting by the Committee for the Empowerment of Women, Meghalaya Legislative Assembly. They said that they would send us the information. But today, I'm getting this information that there are no PECU facilities in any government hospital. This is a very, very serious lapse on the part of the government. Do not say that governments in the past didn't do anything. My question is, why wasn't this brought to the attention of governments in the past and now in the present, where we are likely preparing ourselves for the onslaught of the third wave of COVID pandemic? We need to ask the DHS and the government of Meghalaya, how many pediatricians are there in the state of Meghalaya? What are the locations of these pediatricians? Are you wasting valuable training and expertise of pediatricians by posting them as district medical health officers? What will a pediatrician do in the remote part of the state when his services are immediately required in places where government facilities for pediatric care is there? Number one. Number two, how many PECUs or PECU facilities does this government have in the onslaught of a third wave that might target a new host which has not been vaccinated, because there is no universal vaccination till today? Are we ready? Why doesn't the government immediately bring all pediatricians who have passed and are qualified to the headquarters, where anyways all children who are suffering and are victims of COVID will be brought? If a pediatrician is located in a distant and far away district or block, he will not have the facilities in his PHC or CHC to deal with this patient. He will have to transport this patient to places where there are facilities for pediatric care. How many pediatricians are there in Ganesh Das? We need to ask these questions. Now the government finally, after a consultation with the Committee for the Empowerment of Women, are sending young MBBS doctors for short-term training to Negrams. Why are we sending doctors who are temporarily attached or temporarily employed by the DHS? Why are we not sending permanent doctors to this training facility? We initiated it for them. But again, you're sending. Told that the government of Meghalaya has also got pediatric surgeons. They have 2 or 3 pediatric surgeons. These 2 or 3 pediatric surgeons are not available in the pediatric facilities. They have been posted as medical health officers in some district. What are they going to do with those people in those districts? Very important for us to question. I feel that if up to 5,000 individuals, 5,000 children have been affected by COVID, what is the game plan of the government of Meghalaya? Are we prepared? We've had a lockdown from the 26th of April. Do we have these facilities available? Are they going to be there when our children need them most? And what has happened to universal vaccination? Why is the government of Meghalaya not pressing to the government of India to vaccinate all citizens? We cannot afford to be slow in our policy planning. You have to be aggressive. It is expected of you as a government to be aggressive. And you have to respond. Only then will you have a community that will listen to your instructions. You are saying to manage COVID, we must practice COVID management procedures. How will we manage COVID management procedures when you yourself don't even have the manpower to ensure? Go out to the road today. Some people think there's a lockdown. Some people think there is no lockdown. What COVID management practice are you recommending? If there is no more lockdown, why aren't shops open? Why are you denying the livelihood from individuals? If there is no more lockdown, be clear about it. We just saw one notification issued from the Office of the Chief Secretary of the State of Meghalaya saying that until further notice, as was announced by the DC, these are the procedures that will be followed until further orders. What are these further orders? What is this confusion all about? Look at the traffic in the Shillong city. Are we safe? Is there no more COVID? If there is no more COVID, why are my CCCs still packed? Why are there still patients everywhere? Why are people still testing positive? As of today, citizens are testing positive because they have themselves gone to various facilities. So we need to figure out what is going on. As a public, we demand that clarity should be given to the public as to what is the next plan, where are we heading, are we safe, can people move around? If there is traffic on the road and nobody is stopping the traffic, why are the shops not opening? Have you got a plan for shops? Is there an odd even for traffic? Is there an odd even for shops to open out? We need to plan this. And if government can call legislatures so that the legislative can lend support, where is the harm? Where is the harm? Because I can see that there are only few pockets where the COVID is really, really dangerous till today. It is one thing to practice the containment, pocket containment zone policy, but we need to be assured as a public, are we safe? I'm happy at least to see that there is some improvement on the vaccination. More people have access to vaccination now, but universal vaccination has become the key policy for government to take a call on. This government should force the government of India to take that action after we have heard a statement coming from the Honorable Health Minister himself stating that over 5,000 children have been affected by COVID. Now we are only acting on that. We are reacting on that. We need to know. And these questions need to be answered at the earliest.